Sepsis is a life-threatening medical condition that occurs when the body's response to an infection causes widespread inflammation, leading to tissue damage, organ failure, and potentially death. It can result from any type of infection: bacterial, viral, fungal, or parasitic, but bacterial infections are the most common cause. Sepsis requires immediate medical attention, as it progresses rapidly and can lead to severe complications. Overview. Primary cause: the body's extreme response to an infection. Symptoms: high fever, rapid heart rate, confusion, rapid breathing, low blood pressure, and potential organ failure. Common triggers: infections of the lungs, urinary tract, abdomen, and skin. Symptoms. Sepsis symptoms can vary widely, but common signs include fever or hypothermia. Body temperature may be very high fever or unusually low hypothermia. Rapid heart rate, tachycardia. The heart often beats faster than normal. Increased respiratory rate. Breathing may become rapid and shallow. Altered mental state. Confusion, disorientation, or lethargy may develop. Low blood pressure. Blood pressure can drop significantly, leading to shock, septic shock if untreated. Pain and discomfort. Generalized pain or discomfort may occur. Decreased urine output. A decrease in urination can indicate kidney involvement. As sepsis progresses, it can lead to septic shock, a severe form characterized by dangerously low blood pressure that doesn't respond well to standard treatments and often leads to multi-organ failure. Causes and risk factors. Sepsis can stem from any type of infection, but the most common sources include lung infections. Pneumonia is one of the leading causes of sepsis. Urinary tract infections. UTIs. Untreated UTIs, especially in the elderly, can lead to sepsis. Abdominal infections. Infections of the intestines, appendix, or other organs can spread bacteria into the bloodstream. Skin infections. Cuts, wounds, or surgical sites can become infected, leading to sepsis if untreated. Certain people are at a higher risk for developing sepsis. Elderly adults. Age is a significant risk factor, especially those over 65. Infants and young children. Immature immune systems increase their susceptibility. People with chronic illnesses, conditions like diabetes, liver disease, cancer, and kidney disease can weaken the immune system. Weakened immune systems. People undergoing chemotherapy, those with HIV/AIDS, or individuals taking immunosuppressive drugs are at higher risk. Hospitalized patients. Patients with recent surgeries, invasive devices like catheters, or prolonged hospital stays are at increased risk. Diagnosis. Diagnosing sepsis involves identifying both the presence of an infection and signs of organ dysfunction. Key diagnostic steps include physical examination. Doctors assess vital signs, such as heart rate, temperature, blood pressure, and oxygen levels. Blood tests. Complete blood count (CBC) to check for infection. Lactate levels. High levels can indicate tissue damage and are associated with severe sepsis. Blood cultures, to identify a causative bacteria or pathogen. Imaging. X-rays, CT scans, or ultrasounds may help locate the source of infection. Other lab tests, urine, wound, and respiratory samples may be tested to identify infectious organisms. The sequential organ failure assessment (SOFA score) and quick SOFA Q-SOFA criteria are often used to assess the severity and predict outcomes in sepsis. Treatment for sepsis focuses on rapidly controlling the infection, stabilizing vital signs, and supporting any organ systems affected. Antibiotics. Broad-spectrum antibiotics are started immediately to target a wide range of bacteria. Once the specific pathogen is identified, doctors may switch to targeted antibiotics. Intravenous IV fluids. IV fluids are administered to stabilize blood pressure and maintain organ function. If fluids are insufficient, medications called vasopressors, e.g., norepinephrine, may be used to raise blood pressure. Oxygen therapy. Oxygen or ventilation may be required if the lungs are compromised or oxygen levels are low. Supportive care. Dialysis may be needed for kidney failure. Ventilation support might be necessary if breathing is affected. Other supportive measures depend on which organs are impacted. Surgery if required. Surgery might be necessary to remove sources of infection, like abscesses, infected tissue, or surgical wounds that are not healing properly. Complications. Sepsis can lead to severe, long-lasting complications, especially if not treated promptly. Septic shock, characterized by a drastic drop in blood pressure. Septic shock can lead to multi-organ failure. Organ damage. Sepsis can cause long-term damage to organs, especially the kidneys, liver, and lungs. Post-sepsis syndrome (PSS), a condition where survivors experience long-term effects, such as chronic fatigue, cognitive difficulties, and emotional distress. Increased risk of future infections. Sepsis survivors may have a weakened immune system, making them more vulnerable to infections. Prevention. While not all cases of sepsis are preventable, there are ways to reduce the risk. Vaccinations. Staying up to date on vaccines, e.g., for pneumonia, flu, can prevent infections that may lead to sepsis. Prompt treatment of infections. Early treatment of infections can prevent them from becoming severe and spreading. Good hygiene. Regular hand washing and care with wound cleaning and dressing can reduce infection risk. Care with invasive devices. Proper care and hygiene with catheters, IV lines, and other medical devices can reduce infection risk in hospitalized patients. Awareness of symptoms. Early recognition of symptoms and seeking prompt medical care can prevent sepsis from worsening. Prognosis. The prognosis for sepsis varies depending on the severity, the promptness of treatment, and the overall health of the patient. While many recover fully, some experience lasting complications, and severe cases may lead to death. Recovery can be challenging, especially in cases that progress to septic shock or involve multiple organs. Early intervention greatly improves outcomes, making rapid diagnosis and treatment essential. Conclusion. Sepsis is a serious and often life-threatening response to infection that requires immediate medical attention. Prevention, early detection, and aggressive treatment are key to managing this condition. While recovery is possible, awareness of symptoms and timely treatment are crucial to reducing the risks and ensuring better outcomes.